So, hello everyone, my name is David Bloom. My details can be found at davidbloomdentist.com. I'm a visiting restorative and cosmetic dentist and a past president of the British Academy of Cosmetic Dentistry, as well as being accredited by the BACD. What we're going to talk about today is photography, and particularly with regard to Cfast photography. So that's cosmetically focused adult straight teeth. And photography is a central part of communication, partly with the lab, partly with patients. So we're going to look at the shots that we need to take and really show how easy that is. We will also mention about the BACD accreditation, that is close to my heart, and some of the photos that we need, extra photos. Generally, I would take the same photos, and that's all 15 shots that I take for BACD accreditation. But for Cfast, we'll be looking at 8 shots only. So let's move on and have a look. So digital photography. Essential really. The camera is as important to me as my aorota. I can't practice without it, and really want to show how easy it is to take these photos. But if we look at some of the benefits here, we can see that we don't have to have the rigidity of having film. We have all the flexibility. We can review our images immediately, and we've got a huge depth of field. However, it is a little bit less forgiving than maybe some of the easier point and shoot cameras, but really want to demonstrate that the learning curve is quite shallow, and once you get started, it really is easy to take these shots. So many uses of clinical photography. We have education, and that's education primarily to our patients, but also for lecturing purposes or publications. Case presentations, again, to patients. Lab communication, patient communication, essential part of our records, medico-legal. We unfortunately are in a litigious society. So it really demonstrates what the situation was like before, and obviously what changes we've made. And obviously very useful to record any pathologies, to referrals for our specialist colleagues, and ultimately to market the work that you've done, to show patients and prospective patients what can be achieved. So I think if we're taking photos, we need to be aware that we need to have some consent. And essentially there's 3 levels of consent. We can have our basic level just for clinical records. We can have restricted educational use to show other patients in the practice, and maybe for lectures. And really, ultimately, the highest level is for publications, for publication in the website and magazines, which you may want to be thinking about. So this is just some general ideas of some general consents. Obviously, A is just a consent for confidential records. B is for restricted educational use, and a much more detailed consent. And I'd advocate ultimately asking everyone to sign the most advanced level of consent, so you never know the cases you want to be using. I think it's essential that we're clear that we need to be using a digital SLR, single lens reflex camera. Rangefinders, prosumer cameras, the difficulty is taking the consistency of the shot that we're going to be taking, and we're going to look at that. And really, these shots are very repeatable and the same every single time. And to be able to achieve that, we need the SLR. The rangefinders, they're not suitable for close-up. You're not exactly getting a true reflection of what you see through the lens is actually what you're getting as the image. And it's not going to give you the same close-up shots. Whereas the SLR camera looks more complicated, but ultimately is going to give you a much more consistent view. So the lens that we're looking at, we are doing dental photography is really close up. So we need a macro lens because that compensates for image problems that can be endemic with close-up photography. And we're looking at 100mm plus macro lens. So 100 or 105 macro lens is best suited for dental photography. Why a macro lens? Well, gives us the correct perspective because of the longer working distance. So again, on the screen, you can see the difference in image that you get from a 28mm lens versus a 105mm lens. And it's much more correct perspective. And again, if we're looking at some photos, we can see the differences. And some of these photos, I would like to credit Peter Gordon, the father of modern dental photography, who wrote the book on it, and he's kindly lent me a couple of these slides. So thank you, Peter. That's Peter Gordon. And we can see here the difference again in perspective that we're getting if we're not having a 105 macro lens. And then I'm not an expert on photography. I know how to take the dental shots, and we want to keep it simple. And the key here is the only aspect that we're changing really on the camera is the aperture. And the aperture relates to the depth of field. Now the aperture is the amount of light that comes into the camera. And we can see here the diaphragm inside the photographic lens. And the size of the diaphragm regulates the amount of light that's coming in. And the aperture is calibrated by an f-stop, so we call it the f number. So aperture affects the depth of field, and with a low aperture, that's with a large amount of light coming into the screen, into the lens, sorry, we will have a shallow depth of field. Whereas with a higher aperture number, that's a smaller amount of light, we'll have a bigger depth of field. And what that essentially means is that the back of the mouth is in focus as well as the front of the mouth. So we can recall the depth of field as the zone of sharpness between the nearest and the furthest object. So if we then have a large depth of field, that's a small aperture, that's a high f number, so f22 or above. Whereas if we have a shallow depth of field, has a high aperture, that is a low f number, so f5.6, which we'll be using for our full face shots. So in summary, a large aperture, small f-stop lets in more light, and that gives a short depth of field. Whereas a small aperture, which is a large f-stop, f22 or above, lets in less light, and that gives a greater depth of field. And you can see that summarized on the slide. Finally, we should just talk about different formats that we can shoot in. Largely historical, because not that many people now will shoot in TIFF, but JPEG is lossy compression, and every time it's saved there is the potential to lose a little bit of the quality, whereas a TIFF is a lossless compression. But really what I would be recommending now is that we're shooting everything RAW and JPEG. And shoot the highest quality JPEG that you can, and also the RAW. And the RAW is effectively your digital negative. And certainly for a lot of the accreditation, for the BACD and for the AACD, which is the American Academy of Cosmetic Dentistry, and they've kindly lent some of the pictures that I'll be using later on, their accreditation requires RAW, because otherwise the pictures can be manipulated, and a RAW is a digital image which shows that we have the raw data. And most cameras now, you'll be able to shoot RAW and JPEG at the same time. The RAW is just filed away. Medico-legally, essentially a RAW is a better file format as well, because again, it can't really be altered. And I think courts prefer RAW files because of that very fact. Many different types of digital camera. This is well out of date and will be out of date in a month or two. But essentially, the two best cameras make-wise for digital photography, dental photography, are Canon and Nikon. If you have previous film cameras, the lenses are interchangeable, so that will decide which body you're going to go with. But otherwise, I would say a Canon or a Nikon, and both are very good. Different models for both. The Nikon, the D90, the D is a very good camera, but these are changing all the time. Lens-wise, the main thing is that we want a 100 or 105. You can get a Canon lens to go with a Canon body or a Nikon lens. There are, however, cheaper alternatives. For example, Sigma do a number of lenses that are a little bit more cost-effective. But we really want to be having the macro lens. And the flash, I would advocate still a ring flash. Technically, they are actually dual point, because whilst it is a ring on the camera, they are dual point light sources. You can get external dual point light sources, which the labs sometimes prefer, but a little bit more cumbersome and a little bit harder to use. They give better, probably extra oral shots, but a little bit more cumbersome. And we're going to be using TTL, through the lens flash, to set that up. So really, why do we want the macro lens? Okay, because we can reproduce the image exactly every time. And I'm going to show you the settings that enable us to do that. The final terminology we have is the 1:2 and 2:1 and 1:1. different terminologies. And a 1 to 2 ratio means the image on the film is half life size, whereas a 2 to 1 means it's twice life size. And this ultimately all comes back to 35mm, which is where it all began, and this is one of Peter's slides. And what we see here is a negative is a true life-size image. So what you see on the negative is exactly what you'll see in the flesh, and that is referred to as a 1-to-1 view. So this image is half the size of the teeth photographed and can be referred to as a 1-to-2 view. And the main views that we're going to be looking at are 1-to-2 views, and in fact a 1-to-10 view, which is a full face view. A 1-to-1 is a close-up view. We'll talk about that, but that isn't a requirement for Cfast views. So here, reiterating this point, this is a 1-to-1 view, which is the actual size of the negative. And you can see on the screen here, this is a 1-to-1 view. Whereas this picture here is a 1-to-2 view, okay? Now finally, we need to be aware that digital sensors have a magnification factor. Unless you're going for a very, very high-end professional camera, the sensor will magnify the view half, by 1.5 times. So we refer to the image as a 1-to-2, but the setting on the camera is actually set as a 1-to-3 because of that magnification factor. So similarly, a 1-to-1 view we set on the camera as 1-to-1.5. The terminology of 1-to-2 and 1-to-1 is very established and won't change, and we therefore just have to accommodate that with the digital sensors. So for a digital sensor, the sensor is approximately 1.5 factor of a film. So we set it to 1-to-3 for a 1-to-2 view and a 1-to-1.5 for a 1-to-1 view. So we have this set on the lens. This is an example, and we see the white here is if you were using film, but then when we get to the yellow, okay, this is the magnification factor that we have for digital. And again, we'll look at that close up when we look at the lens. Each lens slightly different, but they all have the two numbers. Finally, we'll need some cheek retractors. My favorite cheek retractors are the individual ones that the patient will hold. The automatic ones, whilst the patient's hands are free, unfortunately sometimes what will happen is the lip will tend to drop down and obscure some of the view. So I think the handheld ones are much better and give us more flexibility. Some good quality photographic mirrors essential for our occlusal shots. Our occlusal shots are probably the trickiest to learn. There is a little bit more of a learning curve, but for Cfast and certainly for the forum on Cfast, essential because it allows us to see the arch movement and if our arch wire is engaged, which is essential so we can assess the right movements. The photographic mirrors do scratch easily, treat them with care. Fogging can be an issue. There's a couple of ways we can get around the fogging, and that is essentially run them under hot water, or you can get a spray that you can spray on. Ultimately, you can make your own anti-fog spray by very diluting some washing up liquid and spraying that on. But hot water works very well, and that will just prevent the fogging. You can have your assistant blow some air from the 3-in-1 syringe, but it's a little bit trickier, more things in the mouth. So if you warm the mirror, that's probably going to be the easiest way. Very briefly, going to talk about how we store the images. Raw images are big files, so I think we need to accept that we're going to need a lot of hard drive space to store them. This is harder to explain and sometimes easier to do a diagram, but if basically you make a folder on your hard drive called the P drive, that's where you're going to store all your photographs. And in that P drive, it's all a question of subfolders. And in that P drive, I'd suggest you make 2 subfolders. One is by case and one is by patient. And we're going to store all the patient photos by patient, but we're going to have a shortcut of any of our preferred cases to by case. And by case, we can then subdivide into Cfast cases, whitening cases, smile makeover cases, full mouth rehabilitation cases. And that's really so that when we're discussing with our patients, we don't always have to remember the exact names. We can have case examples. But because we can copy a shortcut from by patient, we're not duplicating the amount of drive space that we need. We're just copying a shortcut to the patient. So when you think of, you finish a good case, remember just to create a shortcut and put it into your library of case examples. Either that or have a very good memory to remember all those patients' names. So if we go back to by patient, this is where we're going to store all our patient images. And in that, we're going to make a subfolder, a master folder. And I would suggest that is labeled surname.aa, and then DOB, and then if there's multiple dentists in the practice, the dentist name. And that is our master folder. And again, we're going to subdivide that. Inside that, once we click into it, we're going to make some subfolders. And I would suggest they would be something like pre-op. You can then, if it's Cfast, you could have 1 month, 2 month, 3 month, 4 months. Or if it's more of a restorative dentistry case, you might have preparation folder, you might have temporization, you might have fit, you might have recare, you might have portrait. And by having all of those subfolders in there, when we copy the master folder, the surname AA, we're copying all those subfolders. So when we take a patient's details, we copy the subfolder and then paste it. And then in the pasted copy, we change the name, the date of birth, and the dentist. And then all our subfolders are ready to go straight away. And so really from one click, we have all our subfolders. We name everyone by surname, and then first initials and date of birth. It makes it much easier to search by patients. So that's how I would suggest you store your images, because you are going to have a lot of images, because I would photograph every single new patient with the same BACD shots. And by taking all of those shots, we know that we have the necessary Cfast shots as well. And once we're taking the shots, it's just an easy habit, because it takes seconds extra to take all of those shots. So the folder by case can have as many subfolders as you like, as I suggested, and you can work out which ones you feel appropriate for your type of practice. So if we now get to our camera setup, I think the most important message is it all seems very complicated. We look at the camera, it all looks very daunting. It is very straightforward once we understand it, and we want to keep this as simple as possible. And really, we're going to be shooting, just changing the aperture. So on a Nikon, I would shoot on aperture priority. So the only thing we need to change is the aperture. On a Canon, we'll tend to shoot more on manual, but again, the only thing you will need to change is the aperture setting, just that they're slightly different in their setup. So just some issues that we should be aware of that apply to all our photography. We want to eliminate debris. So if we've taken an alginate impression, always wise to remove those little bits of alginate first, make sure there's no bit stuck between the teeth, because it's just a distraction which we don't need. We want to make our proper camera angle relative, and our position relative to the patient. By that means we really want to be shooting straight on. So example, for a smile picture, if you're shooting upwards, you can create the illusion of a reverse smile line when there isn't one. So a good habit is be shooting straight on to the patient. And so our position is the same each time. And in a dental chair, that's relatively easy. We can lift the chair up rather than having to crouch down. We want a uniform background. And so a good tip for practice is when we're taking our full face pictures is to buy a piece of card, a large piece of card, ideally light blue or grey, gives the best backgrounds. An option is that you can have that card, and that allows you to take that to various different rooms if you have a multi-room practice. If you're always taking photographs in the same place, what I know some people do is they have a little roller blind that you can pull down and have the patient stand in front of that. But the card actually means you can sit it, put them behind it in the dental chair. Patient doesn't always need to then actually stand up to take the full face. So just a little trick there. We want to avoid, as I said, tilting the camera. And make sure we're getting the proper framing, and that's really by setting the, on the lens, we know that we're going to have exactly the same shot every time. So we're going to now move forward and actually look at the shots. And again, these shots are, or the pictures, courtesy of the AACD, the American Academy of Cosmetic Dentistry, of which the BACD is an affiliate, although we are our own standalone organisation. So a full face. Really, that's the picture. And if we look at the detail of what we're looking at in this picture, the head is going to be in full view. We want the patient to exhibit a full natural smile, and the patient's nose should be in the center of the photograph. Finally, a uniform background, and this is the card I was talking about, or the material on a roller blind that you can roll down, and should be taken directly in front of the patient. And that's another example of a 1 to 10, and a natural smile. Now, for patients that are unhappy with their smile, sometimes they will find it difficult to smile, but we do want to see the teeth as much as possible, but with a natural smile. So this is our 1 to 10 view, and on this is the only time we will have the lower f number, so f5.6, which is giving us a larger aperture. We'll have a shallower depth of field, and that's because we don't need that depth of field because we're just taking a full face. So that's going to be on something like f5.6, maybe 6.3, something of that magnitude. We're then going to move forward to our close-up shots, and these are the 1 to 2 shots. And so for these, we need to have the aperture on f22 or above, generally f22 or f25, and that's going to give us the depth of field. So it's a small aperture giving us the depth of field, so that the back of the mouth, the molar region, is going to be in sharp focus, as is the central incisors. So the 1 to 2, remember, magnification factor on the lens, so we're going to be setting this on our lens on 1 to 3, although it is a 1 to 2 image. And first of all, we're going to take the 1 to 2 image, what I would call nose to chin, which is a full smile, okay? And we can see the image here. So the incisal plane of the upper teeth should be horizontal to the midline of the photo. Don't want to tilt the camera to compensate for any canted teeth, so we want to be straight on. And if the smile line is canted, we want to capture that, so we don't want to be tilting the camera. And the patient needs to show a full natural smile to document the amount of teeth. Now, we're going to talk about some extra views. Sometimes patients will guard their smile, and there's some extra views that we can use to assess that, which I'll come on to, but they are basically M sound, which shows our incisal display at rest, and E sound, which show maximum display. But if we look at just our classic front smile 1 to 2, a full natural smile to document the amount of teeth and the gingivae they normally display. And finally, we're going to focus on the centrals and the laterals, and the proper depth of field will allow the other visible teeth to be in focus. So that's having f22 or above. So another example of a full natural smile. Now, for Cfast, I will detail the views a bit later on, but for Cfast, that's the only other extra oral view that we need. But for general record keeping, the lateral views are also very useful. And really, what we have here is it's not a true lateral view, it's an oblique view, and it's focused on our lateral incisor. So we focus on the lateral incisor, and the vertical midline should be the lateral incisor. It's not a profile, and so we want the contralateral, central, and possibly lateral to be in view. Orthodontically, yes, we can take a side view, but that would be more for comprehensive orthodontics rather than for the aesthetic orthodontics or cosmetic orthodontics that Cfast is more related to. And so here we can see another example of that view, and we'll take that from the left and the right. So now we'll have our cheek retractors. Either have your assistant hold them, and we'll demonstrate there's a little way that we can rotate and insert them, and then we want to be taking the lips completely apart because we want our retracted views. And these are still 1 to 2 views. And initially we're going to have teeth slightly apart. The reasoning for this is it shows us the incisal edges, any wear. Often in crowded cases we'll see some differential tooth wear, and I know we talk about on the courses about edge bonding when the teeth are straight. This allows us to see the state of those incisal edges. For smile design, obviously it shows incisal embrasures as well, translucency, other aspects. So retractors should be taken with the teeth slightly apart so we can see the incisal edges. We want to see as much of the gingiva as possible to assess the gingival condition and avoid tilting the camera again. And that's another retracted view. And that's the 1 to 2 view. And we're going to take that from the left and the right as well. And that is going to be, again, teeth slightly parted. Rotate the retractors, and by that, if we're taking a lateral view, if you pull this one slightly more, you can relax this view. Allows us to see everything a little bit more on that side. And again, focus on the lateral incisor. And we want to minimize the appearance of the lips and the retractors as much as possible. And that's another example. Now, for Cfast, we're only taking that as a one straight-on view, but from a BACD accreditation point of view and from a general record-keeping point of view, useful to take the lateral views because, again, we can see a little bit more of the dentition. For Cfast, where we really want to be taking, and the ACD don't have a picture of this because they don't actually take this view as much, is its teeth together. So maximum intercuspation, or habit bite, or centric occlusion. So teeth as they would normally meet together. So bite your teeth together on your back teeth, not protrusive, but on their back teeth. And that is going to show us the degree of the static overjet and overbite. And obviously essential for us to be able to assess that. So for our Cfast views, we're going to be taking that straight on, teeth together, and then left and right. And again, that's going to give us a much better idea of the buccal occlusion in habit bite. For Cfast, we don't take the close-up views, but I'm going to run through them so we can see them here. And that's our one-to-one view. So that's our life-size image. And essentially, that is mid-canine to mid-canine. And you can see that in the picture here. And so again, for this view, we're going to use the midline to center on the teeth. Opposing teeth should not be visible. The gingivae adjacent to the teeth in frame should be clearly visible. And one can use a contraster. Now, a contraster is basically a black paddle. You can get dedicated photographic contrasters, or a little tip is you can buy one. They're not cheap, and then you can get some black card from your local store, hardware store, we might say, or Hobbycraft in the UK. And you can cut them out and they become a disposable item. Now, what they're very good at is they highlight the incisal translucency and show some of the effects. My finding is that generally the back of the mouth is quite dark, so I find you don't actually need them. If you are using them, you need to be using them from all the shots. And because I find that we generally don't need to, it's just one less step that you need to take. But some people like them, and they can be very useful if you want to demonstrate incisal effects. But it is an optional. And that's another example of a one-to-one view. And then obviously, as with the previous examples, we're going to take that left and right. So the left view, which again centering on the lateral incisor. No retractors should be visible. Gingivae again clearly visible. Again, a contraster is optional. And we just want to see the contralateral central incisor if possible. And that's another example of the left and right one-to-one views. And so from here, this is when most people tend to get a bit concerned, because then we look onto our occlusal views. Now, occlusal views are essential. They are a little bit trickier, the smaller learning curve, but absolutely achievable with a little bit of practice, and we'll look at how we take those. But that's an example of an occlusal view, and probably the most powerful view for our cosmetic orthodontics as well as for restorative dentistry, to show patients actually what's happening in their mouth. So always use a high quality photographic mirror. The photograph should be taken with retractors in place. Very important. If we're not having retractors in place, the lip will not be away from the facial surfaces or the buccal surfaces of the anterior teeth, and we won't be able to see certainly bracket alignment, whether the wire is engaged. For restorative dentistry, we want to be seeing the facial profile of the teeth. So retractors in place. The central incisor should be just visible at the top of the picture, and we should be able to go all the way back to the minimum of the mesial of the second molar, and is generally achievable, and we'll look at how we do that. When we're taking the lower shot, we want to have the tongue below the occlusal surfaces, so we're not obscuring the occlusal surfaces of the teeth. So, to recap, our 8 Cfast shots are a 1 to 10 natural full smile, a 1 to 2 non-retracted, so that's a natural smile, nose to chin, patient with a big smile. Then we're going to use our retractors, and we're going to take our 1 to 2 views. And initially we want the teeth together because we want to see the static, overjet and overbite. So in habit bite, teeth together from straight on, and then we're going to take our oblique views, which are focused on our lateral incisors, left and right. And then we're actually going to take that with just the teeth slightly apart so we can see any incisal edge wear, any chipping, and assess really the condition of the incisal embrasures for restorative dentistry. And then we want our upper and lower occlusal views. So that's 8 shots. For BACD accreditation, we're going to have the 1 to 10. We're going to have our front smile. We're also going to take left and right. And then we're going to have our retracted front, left and right with the teeth slightly apart, and then the teeth together in habit bite, and then our 1 to 1, our closer view, mid canine to mid canine, front, left and right, and then we have our occlusal shots. And the reason I take all of these is not every case is a Cfast case, and I get into the habit of taking these shots, and then I have the photos I need for Cfast, but I have the photos that I need if it's not a Cfast case. So a good habit to get into used to taking all of them, because it takes no longer. There are a couple of optional views that we mentioned, and that is, first of all, is the M sound. This is where you ask the patient to say mother and just stay with the lips slightly apart. And that's going to assess our incisor display at rest, which is an essential part of smile design and for any restorative cases. And the other picture we take is the E sound. Now, patients that are unhappy with their smile will guard their smile. If we're doing a smile makeover, we need to assess the gingival display. Is that visible? The extent of the gingival display. And if the patient is guarding their smile, they'll stop showing that. If we ask the patient to say E, we'll assess the full extent of their gingival display if they weren't guarding it. And by guarding, I mean limiting the amount of their upper lip movement to not show the teeth. So the other view we'd have is the E sound. So finally, to wrap up, we're just going to look at some common errors, and then we're going to look at actually taking the shots and show you how straightforward that actually can be. But some common errors are we're a little bit too close here, and here we're a little bit overexposed. And this was really before I came to grips with the simple sort of formula that I'm trying to show, which is setting on the lens to give us the perspective of the shot, and by shooting on the aperture priority, knowing which f-stops, we're not going to have the wrong degree of exposure. Here, we're slightly off center, and in this picture, we're slightly too far away. And again, this is by having the camera probably set on about 1 to 4, not 1 to 3. So that's not a true 1 to 2 size image. As evidenced by the fact that we're seeing the nose a little bit. And when we take these shots, when we're setting it, by setting the right number on the lens, we're then just moving in and out until it's in focus, okay? And that's how we have the same shot every single time, because that'll give us the exact perspective that we need. Here, we're a little bit underexposed, a little bit too far away, and here we're taking these at slightly at an angle, canted. But this is a good example of showing habit bite and the teeth together. And then finally, we're a little bit too far on here, a little bit underexposed. Underexposed is better than overexposed, but really by shooting with the correct f-stop, this is not going to be an issue. And certainly TTL, occasionally the camera will just pump out too much light. I'd have a look in your viewfinder, you'll see that it's all washed out. And that's the beauty of having digital photography, is we can review the image immediately. Here, we're too side on and the retractors are visible. And finally, just an occlusal shot, but no retractors, poor framing, and really we can't see, whilst we can see the occlusal surfaces, the lip is in the way of the facial surface of those upper incisors, so not enabling us to see a lot of the detail that we want to see. And here we have a lower occlusal again, overexposed, and we're not really seeing enough teeth, and ideally I'd like that lower lip further away from those lower incisors. So really that's the theory, which is the most complicated part of digital photography. Practically, you'll see that we have very few things to change on the camera, and the biggest learning curve is going to be the occlusal shots, but we're going to look at taking those, and we'll focus and show you how easy it is. I would estimate to take all the full set of 15 pictures, maybe 2 minutes, and I'd encourage you to have your team members all trained up as well, so that anybody in the practice can take those pictures. So it allows new patient flow to become a little bit easier, but essential that we get to grips with using the camera and get familiar with it. And the most important thing really is practice, 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 practice. So let's go and have a look at our demonstration. So we're now in 52 Harley Street. It's one of the practices I work at, and they've kindly allowed us to use the facility so we can show you in a complete dental setting. So this is our digital SLR camera. We have our body, we have our 100mm macro lens, and we have our ring flash. We're going to go through the settings. By changing this, we're changing the ratios, and that's going to give us the right proportions. So the white is if we were on film. The yellow, which you're seeing come into shot, is for digital. So the yellow 10, okay, would be yellow 15, because it's 1 to 10, is a magnification of 1.5 is about there. And then as we come round, the 3 is a magnification of 1.5, so that's what we put it on for our 1 to 2 shot. And then for our close-up, we go to 1 to 1.5, and that's our 1 to 1 shot. So it only needs to be changed. That's the portrait. That's all the 1 to 2 shots, including the occlusal. And this will be our close-up 1 to 1. So this being a Canon, okay, we're going to shoot it on M for manual. But the only thing we're going to change is our aperture, this being our shutter speed. Now, if we change the dial here, it will change the shutter speed. We don't need to change that. So to change our aperture here, we press AV and wind it up to f/25. f/25. If we're on our full face, we're just changing the f-stop to f/5.6 or 6.3. Okay, so this is how we change our aperture, and we only change that once. Only time we change that is for when we do our full face. Everything else is on f/25. So we're going to take our full face, f/5.6. Okay, so this is Heather, our lovely model today, okay? And we're going to start with a full face shot, our 1 to 10 shot. So we have f/5.6, and we have it on our full face setting, and we're going to put it on autofocus. A big smile, Heather, that's great. And there we have our full face shot. So Heather, we've taken her full face. We don't have a card here, so we've taken that against the background, and we've now moved to the chair. And the first thing is we're going to get ourselves in the right position. So I'm just going to lift Heather up a little bit in the chair so that she's at my eye level. I'm not having to crouch down, okay? Top tip, just ask Heather to have her hands folded over, okay? So we can come in here, and then we're going to get close up. And the changes we're going to make on the camera is we're going to take it off automatic focus. We're going to put it on manual. We're going to put our setting for our 1 to 2 view. So we're going to have it on 3, and we're going to have our aperture on f/25. And from here on in, I do not need to change anything except this dial for when we're doing a close-up. Everything else is set up. f/22 and 3 to get a 1 to 2 shot, okay? So now we're going to go and take our photos. So Heather, first of all, I'd like you to have your lips at rest, just say mother, and open your mouth up for me now. Mother. And just stay relaxed like that, that's it. Right. So now I'm going to ask you for a big smile, please, Heather. That's it, big smile. And this is our 1 to 2 unretracted. That's the only Cfast shot we need, but for our full set, we're going to take here, and then Heather's move your jaw to the face to the right-hand side, a big smile again. We're going to just take our other lateral view. So, those are our extraoral views, okay? And just one more, say E for me now, please. E, big wide E. There we are. Okay, those are our extraoral shots, okay? So now, we're going to take our intraoral shots. And for this, we're going to have our cheek retractors. So we're going to just rotate this in. So if we put that there and just roll it round, similarly here, roll it round. Okay, now bite your teeth together for me now, Heather. So Heather, I'm going to ask you to hold these for me and pull them apart. That's it. Okay. So again, get yourself in a comfortable position. So Heather, can I ask you to move your head to the right? That's it. And we're going to take teeth together first of all. So we take front, left, and head to the right, please. Right. Okay, and then back to the middle. Now just open your mouth up very slightly for me now. Big wide mouth. Okay. Front, side, and head over to the other side now, please, Heather. Let me see our views. Okay, now we're going to take close-ups. We don't need the close-ups for our Cfast, but I want them for my general dentistry. So I'm going to put it on 1.5. Just open your mouth up a little bit for me now, Heather. Open up a little bit more. And then. And head over to the right, please. Those are our close-ups. And now for our occlusal views, we're going to go back. It's a 1 to 2 shot, so we're going to have our setting back on number 3. So we've just taken our close-up shots, and my nurse has now warmed the mirror, and we're going to take our occlusal shots. So for this, first of all, on our upper, we're going to have Heather just sit down a little bit lower in the chair. It makes it a little bit easier to get the angle. So Heather, I ask you to pull those retractors really quite wide for me, big wide mouth for me, and we can angle the mirror here, change the angulation to get further back, making sure we're shooting down the long axis of those front teeth. And that's that. Okay, so that's our upper occlusal, and we're now, for our lower occlusal, going to raise the chair up. Just saves you clamping down a little bit. And exactly the same. So, big wide mouth for me now, Heather. Relax your tongue. Now this time I want you to pull these forward. That's brilliant, thank you. Perfect, big wide mouth. That's it, relax. You can take them out. Well done. So, in summary, that's it. That's how we take our Cfast digital photographs. Encourage you to get your hands on a digital SLR and then practice, practice, practice. Thank you.